Hey there, it's Mrs. Reichelt. In our next video, we're going to go ahead and talk about pulse. We'll also talk about blood pressure and how blood pressure is measured, but the major things are going to be pulse and blood pressure. So let's go ahead and get started here. So pulse is just the pressure wave of blood. So it's a way to measure how much pressure is moving through. There's a couple of major pulse points here, or pressure points. So I would say the most common ones are going to be the carotid artery and probably your radial artery are probably the ones that you're going to use. Maybe you've used those in PE class or something. But they're monitored at pressure points in arteries where the pulse is easily palpated, so you're able to feel it. Typical pulse is going to be between 70 and 76 beats per minute. I think last video I told you it was 75 beats per minute, so as long as you're within the range, the averaged ranges, you're pretty good, so don't worry too much about 72 not being a right answer. It would be. So then we get into blood pressure. So blood pressure is a measurement by a health professional, and they're made based on the pressure that is occurring in the arteries. Blood pressure is going to be measured using two different numbers. The first number is the systolic number. This is the pressure that's at the peak of ventricular contraction. So your systolic number is going to be written this way. Your diastolic number is the pressure in which your ventricles are relaxed. So in order to determine your blood pressure, it'll be your systolic number over your diastolic number. I do have some students that try to divide that number and give me some other number. Please do not do that. Just give me the systolic number over the diastolic number. So when you write your systolic pressure first, it's going to be up here. I always think systolic is sky high, and I think that the sky is higher. I'm not sure why I think that, but I always think systolic sky high, so it's at the top. And then diastolic will be below, so that'll be last. So an example of a normal blood pressure would be 120/80. Pressure in the blood vessels decreases as the distance from the heart increases. So hopefully that makes sense, that as you're leaving the heart, your pressure will decrease. All right, so if we compare our blood pressures here, your systolic number is always going to be higher because it's at the peak of contraction, and your diastolic number is always going to be a little bit lower. And then from here you can calculate what's happening with your aorta, your arteries, your arterioles, capillaries, that sort of thing. I think that's kind of a cool picture there. When you're actually measuring your blood pressure, what you're going to do is you're going to find your brachial artery, and then you're going to take this rubber cuff here, your pressure cuff, and you're going to wrap it pretty tightly. So after this, you're going to start pumping this up with air. The purpose of pumping this up with air is to restrict your blood flow. Once your blood flow is restricted, as you slowly decrease that air, you'll then at some point, your blood will be able to go into those arteries. So the purpose of restricting it is so you can get your maximum rate, which is your high number, and then basically the nurse is going to, or whoever's taking your blood pressure is going to, with their stethoscope, they're going to count the pulses or the beats, and you can hear them very clearly and vividly. So the first number, or the first time they hear that beat, is going to be your systolic number. Then the last beat that they can hear will be your diastolic number, so the lowest number. So once you get to that no audible sounds, that then would be your diastolic number, and that's how you take blood pressure. So blood pressure is also written as BP. It's affected by age, weight, time of the day, exercise, body position. So if you're laying down, your blood pressure will be lower than if you're sitting straight up or standing. Cardiac output, we talked about a little bit already. This is the amount of blood that's pumped out of the left ventricle per minute. Then you have something called peripheral resistance. This is the amount of friction the amount of friction that blood encounters as it flows through the vessels. So narrowing of the blood vessels and increased blood volume will increase the peripheral resistance. So blood pressure equals your cardiac volume times your peripheral resistance. So that's kind of how you, if you had to calculate it with cardiac output and your resistance, you'd be able to do that as well. So your blood pressure is going to be controlled by a couple of different factors. The first one are neural factors and the other ones are renal factors. Renal means your kidney. Oops, I'm gonna have to plug in my Mac here pretty quick. Just ignore that for now. I'll just close that out. So your renal factors are going to be your kidneys. So this is basically your excretory system or your urinary system. And then your neural factors, the autonomic nervous system, will make adjustments that affect blood pressure from the sympathetic division. The renal factors will change your blood pressure based on the amount of blood volume that you have, and your blood volume is dependent upon how your kidneys are doing, if they're filtering a lot of fluids, if you're really hydrated versus if you're not very hydrated. So regulating will be occurring by altering the blood volume as well. Blood pressure is also going to be affected by temperature. So when you're hot, there's a vasodilating effect to try to cool you off. Whereas when you're cold, so I guess your blood pressure will be increased. When you're cold, you have a vasoconstricting effect, which will decrease it. Chemicals will also change your blood pressure, so different substances, as well as diet. So a high fatty diet will increase your blood pressure, whereas a healthy diet will decrease your blood pressure. This is kind of a cool diagram, similar to the last video, that'll go through how to increase or decrease blood volume. Sometimes you want your blood volume or your blood pressure to be increased. Other times you need it to be decreased, kind of depending on what the situation is. So let's see, the normal range of blood pressure, normal for anybody, is going to be with a systolic number between 110 and 140. So a diastolic number would be between 80 and 75, somewhere around there. That's normal. Hypotension means you have low numbers, so these are going to be below 110. Hypertension or pre-hypertension is going to be when you have a systolic number of higher than 140. So that can be dangerous as well. Oop, and I guess that wraps it up. So I hope you found this blood pressure section pretty interesting and helpful.